host next month. So it's 13th, 14th, and 15th of June. So Madam is of course instrumental. Madam, you are coming for all 3 days, na, Madam?
Yes. But on workshop days, what is the plan? The workshops
Friday,
are various other places, I believe.
other places. Yes. But Friday evening we will be having our faculty dinner.
Yes.
So
I
you can join.
plan to reach by Friday evening or
Yes,
afternoon.
Madam. Definitely will welcome, Madam. Maya Madam has also joined. Good
Hello.
evening, Madam.
Yeah, good evening. Good evening, Anita, madam. Good evening, Bhavesh.
Good evening, Maya madam.
Good evening, Saurabh. Good evening. How are you?
Dam badhiya.
Still in OT?
Yeah, I'm still in OT.
Oh, hectic day.
Yeah.
Mhm. Okay. How is the temperature in Nagpur?
नहीं आता there's cloudy weather, slightly
Okay.
rainy.
हाँ हाँ.
So temperature is somewhere around 35 degrees. So that is
अच्छा
fine
म्हणजे
for us.
हाँ. नाहीतर समर अदरवाइज इन नागपूर.
Yeah, 40, 41, 42 is routine
करेक्ट
for
करेक्ट.
us.
ह्या
Yeah.
वेळेला तसं समर जाणवलाच नाही मला वाटतं ना.
मध्ये आला काही दिवस.
ओके.
44 पर्यंत गेलेला आहे पण आता
35 must be cool for Nagpur, no?
Yes.
35 is cool. 35 is cool.
Hello, madam. Good evening. Uma, madam. Yes.
Hello.
Yeah. आजचा टॉपिक छान इंटरेस्टिंग आहे.
मिक्स पण आहे म्हणजे
Yeah.
असं वाटलं की अकॅडमिक प्युअर अकॅडमिक पण नाही, नॉन अकॅडमिक पण नाही. इट विल बी लाईक
Yes.
आणि पुढे काय होणार आहे ते जरा लक्ष ठेवायलाच पाहिजे ना म्हणजे.
हो. Hello, Seema. Seema is also there. Seema Suryavanshi, our
Hello.
past president. Yes. Hello, Bhagyashri.
Hello, madam. Hello. Good
Yeah.
evening. Good evening,
Good
everyone.
evening. Yes, good evening.
Good evening,
Kothari
ma'am.
Madam has also joined. Good
Good
evening,
evening,
Madam.
ma'am.
Good evening.
Hello. Yes, Kothari madam, good evening.
Good evening. कधी चालू करतोय आपण?
एक 2-3 मिनिटं
लोक लॉग इन होत आहेत म्हणून त्याला थांबलो होतो.
Even Nasik must be pleasant, na, Anita? Nasik must be pleasant.
Very pleasant.
Ah.
It's raining from 4 or 5 days daily.
Okay.
And Nasik
Achha.
is cooled down because of that.
Yes. Even we
Same
had
here,
cloudy
Madam.
weather.
Yesterday also we had rain.
Yeah.
It became pleasant. Probably we'll get the monsoon earlier this time.
Looks
Yes,
like.
they said that it has already arrived in Andaman 10 days early.
AI बद्दल I just read some
Newspaper
news.
said 10 days early.
की चायनामध्ये there is a AI hospital आणि तिथे सगळे रोबोट्स आहेत, डॉक्टर्स. देर आर 14 डॉक्टर्स हु आर रोबोट्स ओनली. सो आणि इवन सिस्टर्स, 4 सिस्टर्स दे आर रोबोट, म्हणजे रोबोट सिस्टर्स, आणि 14 डॉक्टर्स दे आर रोबोट. आणि यू हॅव टू फीड युअर सिम्पटम्स, सायन्स, आणि मग दे विल टेल यू द इन्व्हेस्टिगेशन. यू हॅव टू गेट दॅट इन्व्हेस्टिगेशन डन, अगेन फीड द इन्व्हेस्टिगेशन, अँड दे विल टेल यू की हे डायग्नोसिस आहे. सो असं काही होऊ शकतं. दिस इज अ फ्युचर. आणि चायना हॅज डेव्हलप दॅट. आय डोंट नो वेदर इट इज रिअली फंक्शनिंग ऑर नॉट, बट आय रेड दॅट समवेअर ऑन सोशल मीडिया.
नाही, ते व्हॉट्सअपला आलेलं होतं आणि बरेच पेशंट्स ते इमिजिएटली खूप फास्ट वगैरे हे डायग्नोसिस करतात, ट्रीटमेंट देतात फटाफट. टर्नओव्हर इज व्हेरी बिग वगैरे.
हा. आणि ट्रीटमेंटचं त्यांनी काही मेन्शन केलं नव्हतं, पण टिल डायग्नोसिस ॲटलीस्ट दे कॅन डू. मला वाटतं ट्रीटमेंटही सांगायला हरकत नाही त्यांना आता.
म्हणजे एक्झामिनेशन नाही होणार ना मॅडम, क्लिनिकल कसं बघणार?
आय डोंट नो, पण आता त्यांनी काय
पोटात दुखतंय तर पोट पाल्पेट कोण करणार?
नाही, गरज नाही आता पाल्पेशनची. सी आता तेच आहे ना. इवन आता US मध्ये वगैरे पण सगळं इन्व्हेस्टिगेशन बेस्ड. तुमचा इन्व्हेस्टिगेशन काय, रिपोर्ट्स काय, त्याच्यावरच ते डायग्नोज करतात. हल्ली जर असंच झालेलं आहे. म्हणजे आणि म्हणजे ते डायग्नोसिस आणि तशी ट्रीटमेंट सगळं टेक्स्टबुक वाईज. पाल्पेट करणं वगैरे आता मला वाटतं लांब जाईल. ते सोनोग्राफी करतील.
डायरेक्टली USG प्रोबच असेल मॅडम. ते स्टेथोच्या ऐवजी प्रोबच असतो ना आता आजकाल.
बज असतो. हो.
हा.
नाही नाही,
आणि
actually there is a lot of automation आणि what it will
ऑटोमेशन.
feed the symptoms as you said. Anesthesia assistant app आलेलं आहे ना आपलं तसं. You feed what is the patient's age आणि हे. तर ते it will tell you also, it will guide you की काय काय करता येईल, what could be the risk. So ऍप बेस्ड खूप होणार आहे आणि
खूप होणार आहे. हो हो
खूप
हो.
आहे. ह्यामध्ये खूप ऑटोमेशन आहे.
म्हणजे आता देर इज रिप्लेसमेंट फॉर डॉक्टर्स नाव आता. असं ऑफकोर्स ह्युमन टच आणि एम्पॅथी किंवा कंपॅशनेट जो
But
काही
the
आपलं
madam has
गेस्चर
just joined.
असतं
Good evening, madam.
दॅट विल बी लॅकिंग.
चलो. आणि प्रेसिडेंट
मी म्हणू ना.
प्रेसिडेंट अनिता.
Should we start, madam?
येस.
Yes.
Yes, I think
स्पेशल
so that we
फॅशन
can
रॅम्प वॉक मध्ये
hear
भाग घ्यायचे.
काय कोठारी मॅडम?
आमच्या युवा महाकॉन मध्ये रॅम्प वॉक मध्ये भाग घ्यायचा आहे. कशामध्ये इंटरेस्ट आहे ते. ओके.
हो 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 मॅडम. येस डेफिनेटली.
डिटेल्स कळालेले माया बोललेली आहे तुझ्याशी.
हो 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 हो. येस.
येस. म्हणून म्हणलं स्पेशल इन्व्हिटेशन आहे. चलो वी कॅन स्टार्ट. आय थिंक.
Yes, I think we should start.
So with the good evening, everyone. Of SAM's president, Dr. Anita Madam, Vice President, Dr. all our past patients, Madam.
Sir, your
Awas
voice
crack
is
होतोय.
Welcome you all,
आवाज crack
all the
होतोय.
delegates for this. Is it?
हा, इन बिटवीन द वर्ड्स आर मिसिंग.
Okay, madam.
यू कॅन कॅरी ऑन, नो प्रॉब्लेम.
Now it is better, madam.
हो हो. येस येस.
So
This is our May monthly meeting, which is with the AI with anesthesia delivered, which is going to be delivered by our eminent speaker, Dr. Subramaniam. And I request Uma Deshmukh madam. Madam is instrumental for arranging this webinar. So, madam, please start with this few introduction.
Thank you, Bhavesh. Good evening, all. Welcome to this very interesting webinar. Today, before our moderator goes to the official introduction of our speaker, I could not help but steal a few minutes to speak about him. As we were searching for a person who would enlighten us about a new emerging topic, Dr. Saurabh Barde suggested his name. And in the very first phone call, I knew why. As he agreed readily to share his knowledge with us, he asked for a few more days to add some important points to his PPT. He said it was a new topic, he was working on it, and he wanted his listeners to get the maximum benefit and develop interest in the new subject. That short conversation told me I was talking to the right person, a perfectionist, a dedicated teacher, and a person devoted to the subject. See, we all have experienced recently how being technologically advanced and updated can have edge over the others in all walks of life. I mean, a very warm welcome, Dr. Subramaniam Mahankali sir from SAPC team. So here we are. I'm sure Dr. Sheetal has had a very tough time picking up things to say from his extraordinary and very long CV. We want to hear as much as possible from you, sir. So I hand it over to Sheetal now. Sheetal, please introduce our speaker.
Good evening, everyone. Thank you, Mama. It is my great pleasure. First of all, I'll welcome all of you. It's a great pleasure to welcome you all for the today's webinar, which is Artificial Intelligence and Anesthesia. We are thrilled to have office bearers of SAPC, SAMS, and all participants who have given their precious time in this evening. As we stand on the frontier of innovation, artificial intelligence is rapidly transforming the landscape of healthcare, and anesthesia is no exception. artificial intelligence is a broad concept which is machines designed to understand and perform the task on their own in a smart manner. For example, target control infusion pump, which deliver the precise drug to achieve the target blood concentration of particular drug. So the ability and artificial intelligence has one more ability to adapt or to learn from the process. Like if we set this in the particular, we want the bispectral index of some value, then the range is assessed by the machine itself and it will deliver the accurate drug. So it is adapting by calculating the various data it is receiving. Another new subset of artificial intelligence is robotics. Nowadays, we are getting lots of videos that robot is doing the intubation. And one more thing, ChatGPT, which I also use to give some welcome note in this topic. So now that the world is rapidly changing with AI, we should be no exception because we have to adapt to the new scenario. Otherwise, we'll be left behind. So to guide us into this new reality, new world, we are honored to join by our distinguished speaker, Dr. Subramaniam Mahankali. He is on at some world's most prestigious institution, including AIMS Delhi, NIH UK, leading corporate hospitals. As a head of department of anesthesia at Aster RV Hospital, he has set a new standard in complex anesthetic care, including pioneering anesthesia in liver transplant and other high-risk surgeries. As a part of postgraduate certificate program in digital health from IIM Raipur, he has completed dissertation which shows implication and recommendation for healthcare data protection in India, which reflects his commitment to the advancing data protection in healthcare. Additionally, Sir is leading transformative initiatives such as developing voice to text medical case sheet conversion program and establishing green anesthesia platform to promote the environmental sustainability. So known for his total intravenous anesthesia, point of care ultrasound, and digital health, Dr. Mahankali exemplifies a visionary approach to modern, precise, and responsible healthcare. He has been a call to lots of international national conferences. He has many publications. He has chapters in Stolting Pharmacology textbook also. So I think if I start talking, the whole webinar will be of his achievements only. So now welcome Dr. Subramaniam sir. Please enlighten us about the today's topic.
Thank you, madam. Am I audible and the screen visible, madam?
Yes, sir.
I'm indeed honored to be amongst you all. Welcome you all to this evening, and together we will have an interesting 45 minutes to an hour. So I carefully want you to read this particular sentence here. AI is probably the most important thing humanity has ever worked on. And in the next sentence, he says, I think of it as something more profound than electricity or fire. I think it's coming from a person like Sundar Pichai. We have to really think through and read between the sentences and lines here. There are a few general purpose inventions which can have a profound impact on every aspect of our life. And I also feel strongly that this is one of those. Now, I don't know how many of you have read this book or heard this book. If you have not, I exhort you to read or listen to this book, The Coming Wave by Mustafa Sulaiman, in which he highlights the three waves which are coming together. I don't know whether we should call it a wave or a tsunami, wherein which you have artificial intelligence, synthetic biology, and robotics. They are going to come as tsunami, and it will probably take the world by storm. Now, along with this, what is happening is the building blocks of digital health has now, we have all these part as a part. For example, the number of data sources which are available to collect, the digitalization of the healthcare and documentation has happened. A number of wearables and smart devices are expanded, wherein which we can collect data about each individual. There is progression in the digital therapeutics, cloud computing, and also Internet of Things. Combined with AI, this is going to form a tsunami wherein which the entire world will be immersed in this. Artificial intelligence probably has rapidly changed the way we live and work in every part of the world now. It has shown remarkable progress in various fields, including medicine. The integration of AI into medicine has enormous potential to improve the patient outcomes and increase the efficiency in the healthcare system wherever we are working. The first important component is the digitalization, which is rapidly happening in India. Now, let us briefly look what is AI. Now, AI essentially is the ability of a computer or a computer-controlled robot to perform tasks commonly associated with intelligent beings, that is humans, most of the times. These processes include, in one way or the other, some amount of learning, which is acquiring the data and the rules for using the data, reasoning, using rules to reach approximate or definitive conclusion, if need be self-correct, using neural networks, and increasingly, we are also having AI systems or computer systems in which sensory input also can be taken, for example, vision or sound. And some of the devices can even deliver smell at appropriate time if you're using it. So, for example, if you're using a VR or extended reality, along with, let's say, for example, if you see Shah Rukh Khan on that device, you will also have a pleasant smell coming out, which is almost similar to what he has. Now, carefully look at this number. So, in 2023, the FDI had already authorized 882 devices based on AI, where it is using AI. And 2025, as of now, by March, there are 1,016 medical devices that utilize AI and machine learning for medical purposes. Believe me, they have gone through FDI regulations, right? Not small regulation, FDI regulation and approved for use. That is the amount of development which is happening. Along with it, what is happening is the medical data is exploding. The number of people accessing healthcare, the data, kinds of data which we are using. What was doubling time was 50 years in around 75 years back. Now, probably in a couple of months, the data will get doubled. Humongous amount of data is there. When so much of data is available from different sources, the computers start to make a difference. Especially the advances in the computing, especially the quantum computing comes in, any amount of data can be analyzed and can be used in a way which can make our lives easier and simpler. Just look at the market value of projected things. So the projected value by 2030 in AI in healthcare is $194 billion. I don't know, probably it's more than what we are putting in for the healthcare. For example, NHS UK has around 1.25 billion pounds. So if you multiply by that 160, probably the entire world is spending on the healthcare is around 160 or 180 billion. But AI itself is garnering such a huge market that the market size of AI in healthcare is huge. And if you are a business-minded person, we should seriously think where we can fit into it, make some use in our personal lives as well. There are 3 or 4 important things what is happening. There are a number of definitions. I don't want to go through those definitions and bore you all. The key things which are happening, which are developing, is in the robotics, in the image recognition, the machine learning, and the natural language processing. Now, I will come to each of these as we go on. We'll make it easier because I don't want to bore you with those explanations in the initial start itself. Now, let us see what is its role happening in the healthcare and then come to anesthesia. Now, in the healthcare, every component is getting influenced. For example, if somebody has an ailment, it can help you detect ailment early, improve the decision making by the person who is using it for the diagnosis of ailments, help in the treatment, expand the medical services, help the people associated with the care, and for patients giving a superior experience. Along with that, just for example, you see, it is very common nowadays to find people wearing a continuous blood glucose monitor. And gone are the days where we had to prick and check the blood glucose. Now, this continuous blood glucose monitoring is already available. Nowadays, I have a few people who say, if the doctor is not used to CBG analysis, then he's not up to date with the technology. I don't want to go to him. That is the kind of awareness which is there, especially in the knowledgeable IT community, and also helps in the end of life care. So almost every component in the entire journey of health and healthcare, the AI is getting involved. There are innumerable of companies coming out with their own products every few days to weeks now. So now medical AI applications include, especially looking at the medical imaging, helping in the diagnosis, making a treatment plan, and more importantly, clinical decision support systems. They are very, very useful wherever you are. So whichever system you are in, a slightly one generation behind system also can help you. Now, AI algorithms can also help you diagnose the medical images, predict disease progression, and also in treatment planning. I'll give you examples for all this, how it is already being incorporated. Because so much of digitization is happening, it will help in the process and analyze the electronic health records. Now, if you see the journals, there are articles which are published predominantly based on looking at the electronic health records. I will show you a few examples. I'm sure you will want to use them when you start using in your healthcare. I'll give you some examples. As we go, we'll expand on each and small part of it. Now, for example, let's say you have an AI system in which you scan the drug. The moment the computer says, oh, you are taking out vancomycin, be careful, this patient can have red man syndrome. You have to administer it over 1 hour. That's the simplest of the things. The moment you scan something, that will give you something. Along with the rate, most of the barcodes, QR codes can tell you what is the rate. But it's very easy to incorporate an alert there. Okay. Now, next look at this. For example, we all use a pulse oximetry. Now, with the pulse oximetry, using AI, it can suggest whether the patient is hypovolemic or not. It's not really, we all have used it, but it is all because of some amount of AI incorporation is already happening in the devices what we are having, right? So AI is nothing new there, but the amount of devices, the amount of it being using is expanding rapidly. Now, one of the fundamental, basic AIs is where it is based on a rule or a map-based diagnostic AI. For example, let's say in this diagram where you're calculating the QTC interval. Now, most of us, I'm sure, especially in the bigger corporate hospitals or bigger university hospitals, we have stopped reading the ECG because there is an amount of AI incorporated into it. So in this, for example, if you want to calculate QTC, the AI can easily calculate, incorporate in the chip and tell you what is the QTC interval. Right? For example, if there is change, either in the potassium level or in the ECG waveform, it can easily suggest there is hyperkalemia and give an alert that we have to follow treatment for severe hyperkalemia in this case. Now, generally, AI is very easy to adapt if there is a clear-cut answer, right? That was how the early AI systems were there. For example, if the answer is a binary, for example, if somebody is asked, is it hot or cold? It's very easy. It is yes means 1, no means 0. But we all know in practice, especially in biology, in medicine, it is not clear-cut. It can be variable and variable to multiple extent. It could be very simple as a fuzzy logic, what it is here. If it is hot, you can say very much hot, fairly so, moderate, somewhat, and very little. But there can be more than this, depending on the context. So that creates a sort of a neural network here, in which each of these things is dependent on a particular node, and that is called the neuron or a neural center or a nodal center there. Now, some of them, the deep machines or machine learning uses all these algorithms to come to behind a diagnosis, right? Keep this in mind. I'll come to this later as we go on. Okay. Now, let us see some of the other applications which are happening in real life happening. For example, every one of you, I'm sure, you travel around, you get patients with speaking multiple languages. One of the most useful things in the recent times has been Google Translate. Now, with the Google Translate, you can translate from any language to any language. Now, because Google has been developed by the American systems, it can translate only to most of it are non-Indian languages. What about people coming from Bihar? What about people coming from Orissa? or Telugu, or anywhere, any part of the country. So government of India also has invested massively into this and developed this program known as application known as Bhashini. Now, this Bhashini is a Indian digital solution for translating the languages. Now, because it is getting used to the Indian dialect, how we pronounce in Marathi or Kannada or Telugu, so they can understand it and translate it to any other Indian language, isn't it? For example, I'm sure if you're working in a bigger center, it is very common to get patients from Bengal or Northeast or Kashmir. So whatever language, Indian language, 23 Indian languages are there, they're there in this Bhashini. So if you have not started to use it, start using it from today, because the more we train our Indian systems, the more it will get used to the lingo and all the pronunciations, what is different in other countries. Now, how it is going to help, I'll tell you now. Now, people call it as ambient intelligence, as medical AI. I'm also trying to work around, get some systems going on here. Now, in the olden days, when patient comes, we used to look at the patient, take a full history and document it in the sheet of paper. But when the computers came to us, so we had to type it into the computers. So we used to ask the patient, directly type it into the computer. There was a loss of eye-to-eye contact with the patients. They were not able to appreciate or understand the cues from the doctor. We were also not able to look at them consistently to understand a few things. So that created a huge gap. Then people were not liking digitalization. But with the advances happening in the AI and the digitalization, it is possible to have a device like, for example, let's say Alexa. You have an Alexa like this, and with that, you just have your conversation with the patient. So automatically, it records the conversation. It converts into language, whatever you want. And from there, it can, from the speech, it can convert it to text. For example, whether you're speaking in English or Kannada or Marathi, can convert it into English, and those text can be easily converted to medical notes. And you can give a format. For example, you can have an anesthesia format or a surgical format, etc. You can easily put that data into the system in whatever format you want. You can have cues there as well. So this slow progression is happening in what is known as an ambient clinical intelligence. It's one form of big AI which is happening there. So in this, there are multiple components. First is, if you're talking them, it can recognize who is the doctor, who is the patient, and it can also recognize only the voices, not the noises, right? And it can also pick up different voices and say, this speaker is this speaker is this, and it can convert whatever language which you're speaking and into the text in the form of a word, right? And then it learns, slowly keeps learning. And it got multiple speech language recognition. And using the generative AI, it can format into the form whatever you want. That is what we want, isn't it? We want to treat the patients, we want to touch them, we want to visualize them, examine them, whatever we are saying. For example, blood pressure is 140/60, it will document it. Heart rate 85, it will document it. So patient is hyperthermic, temperature is 37, it will record it. And this is exactly what we want. Not only in the bigger centers, every place we need to have something like this. The only disadvantage is it needs to be connected to the computer. But now slowly, with the advances happening in the connectivity, we soon have very much devices like that. Now, let us briefly look into this consumer segment where it is happening. This is a huge advantage happening in the consumer segment, wherein which the medical advances are happening because of happening in the consumer circle. Now, there is a huge population belief in these devices. One such example is this Apple Watch. Now, we all thought Apple Watch is only a device to see how fit you are, how much you are walking, so etc. Right? But carefully look into this. There are a lot of digital advances which are happening and AI advances happening in each of that, which can be applicable to this. For example, this inventive circles are there. No? For example, almost all the watches use this. There's a circle there. You have set yourself a target of 8,000 steps or 10,000 steps. It will show you in a circle whether we have achieved it or not. Whether the calories we have achieved, standing time we have achieved. In that way, it will give you, this is called a gamification, right? We all want to play a game. We want to watch a game wherein which there is a victory or there is a completion of it. And this concept is being used by Apple as well, right? So that is a very common available. Any other watch also can do the same thing. Now, not only this, it is also being used, adopted, FDA approved for medication management, tracking body metrics, communication with the patients, all these are possible even in a smartwatch like Apple Watch. What also is required, which we have to recognize and slowly start to use is these watches developed by tech companies. They can produce ECG, which is almost as close to what you get in a 12-lead ECG, and can recognize arrhythmias. That is wonderful, isn't it? The patient at his own place, wherever he is, he's able to record the ECG, and these devices can pick up arrhythmia. It can tell the patient, also communicate to his doctor that he's having arrhythmia. What a wonderful development, isn't it? Now, what also you see here, now, these are all in the consumer segment. I understand that. But is there anything which prevents us from using it in the healthcare? I don't know. I don't think there is we should be open to adopting these technologies. For example, within the Apple Watch, it can tell you how much is your asynchrony while you're watching. It can also tell when you have fallen onto the ground. Now, so especially if you are using an Apple Watch, everyone above 55, automatically it gets activated. That fall detection is there, right? Obviously, when the initial days, there will be some wrong cues, wrong examples going, wrong alerts going. It will happen, but the refining is happening, wherein which it can easily alert somebody, an elderly person going out for a walk or at home. If you're if they fall, the watch can pick up and send a signal. Now, the other big change that is happening is continuous blood glucose monitoring, right? This is a game changer for patients with diabetes. In India, we have 30% of the patients who are diabetic, right? So now monitoring them, going to the laboratory, checking it, or pinprick test, all those areas are still relevant. But if you have this, you can know when your sugars are going high. With this food, for example, if I eat dosa, my sugars are going to go up like this. If I have anxiety, it is how it's going to react. If I eat ice cream, this is how it's going to. If I eat a fruit, all this can be seen and appreciated, and correction can happen within that small loop. And the AI can be built into it and say, no, you're eating too much. Your sugar is going high. So your sugar is going low. So all this can be built in, right? So that is how the AI is there in the consumer segment now. Now, let us briefly see what is this Turing test, right? Way back in 1950, probably you can call him the first or the godfather of computing machinery, he's the first one to propose that computers can think, wherein which he devised a test where the person who sits on the computer or with a device and talks to a device, and they had to differentiate whether it was a computer or a human. Nearly 75 years back, he was able to put in a system wherein which, if you are not able to distinguish between the two, that means those machines can think. How right he was, from way back 75 years back to now, we have systems which can talk to us, which can make us think. And in 2011, there was a TV show called Jeopardy. So wherein which two previous world champions in this, played against this computer. It involves Jeopardy game, involves multiple kinds of tasks. And all those tasks were performed by this Watson, that is the AI generated computer, AI using computer, and it could beat them. So 2011, I can call it as a landmark year where the AI started to get prominence. Now, the last few years, we have all seen ChatGPT has entered, and ChatGPT has been trained by billions of pages. And the latest version of ChatGPT can also access the internet also. For example, if I want to ask about Dr. Uma Deshmukh, it will tell me where is she working, who are his colleagues, and it can give me that within a matter of few seconds. So that is how the ChatGPT is coming there. Now, what also is revealing, you should see here, people using the number ChatGPT in their life is 1.8 billion as of April 2024. It's mind-boggling. So many people are using it for various purposes, to optimize their communication, to do something, or whatever it is. Is it the most well-trained model? It has been trained there. No, no. Do we have a no? If you ask anything, it will answer. But a lot of times it may hallucinate. It may give you wrong things. But if you tell it, no, you're wrong. You're wrong because of this. It can understand and correct itself. That is the beauty of this ChatGPT system, for which it has been trained on large language models. Now, one of the important things whenever AI is used is knowledge representation in the back of it. What are this knowledge representation? Every form of AI with the loop is there. It follows these particular kinds of knowledge representation, whether it could be rules or maps. What is this? I'll slowly handle one at a time. For example, a non-expert user has a question, has a query. He asks the user interface. The user interface, from the interface, it goes to the inference engine or a rules-based machine. Now, it accesses the knowledge base, and this knowledge base is developed by an expert. It could be one expert, it could be 100 experts, and that gives the information, and it fed back to the non-expert user. That is how the normal low-tech AI looks like. There are advantages in this. For example, let us talk about rule-based approaches to medical AI. I'll give you some common examples. For example, in a lot of investigations, let's say HbA1c is one of those common things we do. If you teach it, you have to report it as a diabetic. So if the value above 6.5 is diabetic, it will tell you as diabetic. So if the PR interval exceeds 200 milliseconds, you should call it as a first-degree heart block. It can easily recognize it and give it. If the BMI is above 30, it can diagnose you are obese. So these are all simple rule-based medical AI, which can be incorporated to any of the machines. Now, the other next class is semantic-based AI, right? In this, for example, let's say a man, he's a human. So, and what is his name, age, etc. is a straightforward semantic because only 2 or 3 choices. For example, there could be a bit more choices. For example, Jim is a person on the right-hand side and is also an animal. Susie is like Jim, is a cat, and it's an animal. Fish is an animal. Susie is also, so it can think through this network and come to a conclusion what it is. It keeps on learning. Sometimes when it's doing, it can make a bit of error. And some of them, most of it, we try to, we want explanation. For example, if a AI or if a person, if I ask a question, if they answer it, we want an explanation how they obtained it. But sometimes this AI can explain how it got to that answer. But now, as of now, because it is so much of complex nodes are there, sometimes it is not able to, but more and more we are having explainable AI. So, and that is part of the AI system nowadays. Now, I'll give you a few other rules-based examples, right? For example, clinical early warning systems. Now, clinical early warning systems, it was probably first developed in Royal Marsden Hospital in London. But what did they do? So what was there? We all, in one form or the other, we are using it. But in this AI generation, it's a computer-based system that helps to identify patients who are at risk of deterioration and provides early warning, right? They're commonly used to monitor patients, whether they are in wards or ICU, etc., and provide real-time assessments. Now, what does it do if you have electronicization of the data, or you can feed that into it? It can take these parameters and also follow a rule. For example, instead of a nurse scoring, if you feed those data, whether on either side, whether respiration is low, you should give a count. If respiration is high, you should give a count. All these parameters, it can use it and come to a final score, wherein which it can trigger a response. The response can be in the form of an alert, or it can send a message to the particular doctor also. So, for example, it could tell the nurse who is feeding it or machine picking up it. Nowadays, we have Dozy. Dozy is an AI-based monitoring system, which is like a bed sheet. If it's put below the patient, it monitors all the vitals, transfers it into the monitor, and it can send an alert whenever things are going wrong. That is wonderful, isn't it? So nurse may be busy with some other patient. If it picks up and through the monitor sends an alert that patient is not doing well. Now they could slowly increase the frequency of monitoring, or probably ask a doctor to come in and see. And it could also probably send to if, for example, our Michael Jackson had one such dosi or AI-based bed sheet, so we could have prevented his death. We could have had his music continuing even now. Now, what also in the medical context is happening is in few other fields also similar thing is happening. For example, if there is a stain, if a gram stain is done, so if it is a gram positive, so that, and also it's a coccus, and also it's a chain, then it can possibly streptococcus. It can tell us. Now, from the rule-based, it is streptococcus. It is now moving to probability that it can be a streptococcus, possibly streptococcus. This is the next level of AI, what is happening. Even more clinical relevant for us is, for example, we can have a map-based approach to medical AI, where, for example, if you do an ABG and send it, so you can tabulate, you can know what is the hydrogen ion concentration, CO2, and put it in a graph, put it in a map. It can automatically put it and tell you where your diagnosis, what could be your diagnosis. This is a map-based diagnosis. You can also have a flow chart-based diagnosis. For example, you can go through systematically in this way, flow chart. If it is less than pH is this, more than is this, then look at the bicarbonate levels, CO2 levels, and slowly it can lead you to a diagnosis, whether it's a combined acidosis or uncompensated respiratory acidosis. Because it gives us a diagnosis, it helps us optimize the therapy. We don't need to be, at one time, memory was the strongest domain. Nowadays, with access to the technology and AI and internet, all these are becoming easy. I would not be very difficult to say whether it's partially compensated acidosis or etc. But with AI systems, they can do calculations very, very easily. So these complex things also can be made easy. Now, other common examples, I want you to carefully listen to this. Now, we all get patients with pacemaker. Suddenly they come without any details about the pacemaker, right? You just take an X-ray, use that AI website or use a bedside app or whatever it is there. You just take a picture, X-ray picture and feed it to this. It can tell you within seconds what kind of pacemaker is it. Does it have something which can do, which can give a shock as well? It's a what kind of pacemaker it gives you. What a wonderful tool, isn't it? Patient need not tell, or sometimes they may not be able to communicate. Just because they have taken X-ray and feed it into the AI, it can tell you of the 500 odd companies which manufacture the pacemaker, it can tell you what company it is, and also probably tell what kind of pacemaker it is. Now, farthest influence is happening in the field of radiology. Now, radiology, you can almost say it is almost the third eye, because they have got a lot of images, and these images can be used to train the systems, and it can choose, it can diagnose and predict the disease is what is happening. For example, how many of you read through Nature? I don't know. Nature is one of those all-time best magazines. If somebody has a publication in Nature, you can take it as somebody above normal intelligence. And this is a very interesting article which came a few years back, wherein which they compared the AI looking at the mammogram and the humans looking at the mammogram, right? So, and because it has got implications. When mammogram is positive, it has got implications. When mammogram shows negative, it has got implications. But AI can be used very reliably and to give everyday results. No doubt at all across the appropriate AI is used, you can have a fantastic diagnosis. Of course, there were some misses. So there were some misses where the humans missed it because it was too small, and AI also sometimes missed it. But what it looks like is the future is wherein which every human or every radiologist is using AI to initially screen, rule out what are all those normal, pick up those which picks as abnormal and have a close look. That is wonderful, isn't it? We don't want to be relying completely on the AI to say whether it has got a malignancy or a tumor, etc. So whatever the AI picks up as abnormal, that can be reviewed by humans. In that way, the diagnosis can be more accurate. Humans can use their experience, and maybe in future it will probably there, but still I feel the human component will still be there to help us diagnose even sometimes what machines may not be able to completely be accurate. If you go into the chat GPT, yesterday I went into chat GPT and to see just to find out what it says about AI applications in anesthesia. Now, a lot of times it gives wrong answers or half complete answers. You look at the list here. The chat GPT is able to give us what are all the AI applications in anesthesia. Now, it is true. It can be used for preoperative risk reduction, intraoperative monitoring, drug delivery. We'll see how it is being used for post-operative monitoring, workflow optimization, and natural language processing. All these are the domains in which ChatGPT is already telling us, right? So, but let us see how it is being used. Now, if you go through classical talks, classical domains, no, there are 4 main domains where the adoption of AI is happening. As Madam was telling at the start, we are talking about closed loop anesthesia delivery systems. What are they? What are the components? We'll quickly look through. More important for every anesthetist, wherever digitalization is there, or apps are there, smartphones are there, is clinical decision support systems, right? So, and teleanesthesia, we'll leave it for now, and I'll see how mechanical robots are being made part of the anesthesia domain. Now, if you carefully look at it, you can say AI has applications both in the preoperative, intraoperative, and the post-operative phase. For example, we all want to do a comprehensive preoperative evaluation, pre-anesthetic evaluation, right? Now, if somebody is a patient who comes with wearing any of these wearables, it could be a smartwatch, or it could be a smart finger, a smart ring, or a smart belt, and comes and says, here is my data. I walk 15,000 steps in a day. Now, I am wearing a smart shoe. So this is the data from here. Now, when I sleep, my heart rate variation is this. When I climb stairs, my heart rate goes up to this. I can climb 5 flights of stairs without my heart rate going up to so much. It's a tremendous input, isn't it? If somebody is able to go all the way up to 2 or 3 floors without much changes in the heart rate, without heart rate going up to that target heart rate, that is what we want. We don't need to ask for anything else. It says, and it can easily be understood. So now we can also understand how much they can tolerate also. In that way, all this data from various sources, whether it could be from from this or from the patient files, there is there are quite a few hospitals which are building a human digital twin. This human digital twin is exactly the same as us. With the same parameters, for example, same height, same weight, same same gender, etc., but also has the input from these variables. It could be about sleep pattern, how we behave, how our heart rate is when we don't sleep, how we get affected when we see a movie, or when we hear a bad news or something else. So all these can be used to assess how fit the systems are, how much are they able to tolerate. And this human digital twin, I'm pretty sure the next few years, all of us will be competent to create one human digital twin and start using it how to do, right? Before the surgery, it can generate an AI model. Using AI, we can generate a model, the digital twin. And if you put in those lab work, along with this input from the various devices and imaging, and compare to the past files, and also have some red flags. For example, this, if he claims this much, he's allergic to this, etc. All these are potentially fantastically, usable information for us. It can help us plan. Sometimes say, no, you need physiotherapy, you need rehabilitation for so many days. You're not ready to come for a surgery. No, you're happy. Come tomorrow morning. Absolutely fine. You already optimized. And this AI models can help us do this with much more reliability than just one opinion of one person or one experience. The other biggest domain is in the delivery of closed loop anesthesia. This especially is possible. It's also possible in volatiles, but also possible because we're using total intravenous anesthesia, especially if you're using target controlled infusion. If you are able to monitor the brain activity and look at BIS, where you want to keep the BIS between 40 and 60, you can feed that information into the pump, through this patient monitor or a system, where which the moment it goes up, it can increase the target by a little bit. If the patient is too deep, for example, we all know giving too deep anesthesia is not good. If the BIS value starts dropping below 30, there is something known as a burst suppression which has happened. all these BIS monitors can give this suppression ratio and let us know. We all know if the burst suppression happens for more than 15 minutes, POCD can happen very, very easily. Number of patients have reported, especially if you had somebody elderly in the family who's had a surgery, you go and ask them, they feel very different. And there are a number of anecdotes wherein which if they have a deep anesthesia, they come out and say, I'm no longer the same. One poet is there, he could no longer write poetry. All this may be because we were not closely monitoring the depth of anesthesia. Now, with this AI application, with this closed loop anesthesia delivery system, we can ensure that appropriate BIS can be targeted, not too light, not too deep as well, right? But imagine this was the first level of hypnosis. Now we have nociception monitoring and neuromuscular monitoring. If you can feed all these three, how the patient, they are asleep or not, whether they're feeling pain or not, and the muscles are relaxed or not. What do we do for the nociception most of the time? We give painkillers through IV route. Now with drugs like remifentanil available, it can immediately increase the depth or give nociception cover. If the patient is not relaxed, it can immediately top up. So all this can be fed into a system, fed into a computer. It can automatically control, supervised by us, yes. But sometimes, quite a few people are busy with their other things, which should not happen. But this is an advance what is happening. The entire component of anesthesia, whether it is sleep, it is nociception, or neuromuscular or blocking, all this can be part of a closed loop. And this completes the closed loop of anesthesia. It is there for us to start using it. Now, what also, we all know patients are getting older. They're a bit worried about how their heart is, etc. Nowadays, you have ultrasound machines which can do echocardiography and also built AI into it. For example, some of them are portable devices as well, in which they can automatically help you recognize what is the LV, how is the LV looking. It can draw a picture and show you, also calculate real-time LV function and wall motion abnormalities. That is amazing, isn't it? The machines which are there, which can portable everywhere, they can help you look at the particular part of the heart and give you a judgment, what is the ejection fraction? Where are the, which part of the heart wall is not moving properly? That gives a wonderful reassurance to go ahead with anesthetize. For example, I was speaking to our few colleagues who are very active in the poker circles. Nowadays, if that machine support or the AI support is not there in your bedside ultrasound machine, there are companies which have come out, especially this US2.ai is a Singapore-based company. The standard views, what you take, 6 views of heart, you take those pictures, images, especially videos, and feed it into this. It can give you a comprehensive report of valvular things, wall motion abnormalities, ejection fraction. It can give up to 9-page report, more detailed than any of the cardiologist looks. At this point of time, the cost of it might blow your mind. If you feed it, it can take only 150 rupees. It will charge only 150 rupees or 2 Singapore US dollars for doing this. Imagine if you go to a cardiologist, technician does it, technician stores the image, and cardiologist comes and views for a few seconds and says, okay. All those things are done by technician. Those technician roles can be done by this AI. And at what cost? 1/10 the cost of a normal technician or what people pay for echocardiogram. And we may not use it for diagnostic purpose. If you know something is abnormal, you can always refer to cardiologist and obtain a comprehensive diagnosis. But it does help you in making decisions. AI systems are there to help you recognize which is the IVC, whether there is IVC collapsibility or not, and also recognize, for example, if the lung is overloaded or not. It can tell you automatically the moment you put, oh, there are more B lines, be careful, there could be fluid overload. And what also in the last few years, I don't know how many of you had a chance to go into one of these workshops, wherein which we are in an age wherein which we can predict whether hypotension will happen or not using these specific monitors, and you can predict it up to 10 minutes in advance. That is what is the push from the manufacturer, right? So, but of course, not everything goes right. Sometimes, there is a plus and minus there. Here, is a review which says that, yes, from hope, it had a huge hype, and probably monitoring our arterial blood pressure, invasive arterial blood pressure, can give as close an information as possible with those hypotension predictor HPI monitor, right? So this is what, sometimes you go too far ahead, 2 steps ahead and 1 step back. So, and that is what is the beauty. With the AI, we can adopt and we can come back. What also is happening is, see here, so the bedside ultrasound machines are coming, which can help you in regional anesthesia, wherein which it has been trained to say which are the nerves, how the bone is, where the artery is, where the vein is. And it gives, especially for novices or people with less experience, it can give you a cue where those nerves are, so that you don't injure the nerves, so you don't injure the blood vessels, right? It can also be used in epidurals. So what also is coming out is the robots, which can help you in intubations as well. So it has been used in real time also. This one is again Magellan robot, which has been used, which can be used. What also is available coming up with using AI and robotics is how to assess, how to do the blocks as well. For example, once you put the probe and connect it to the machine, it can identify and give a block. This is a populated block given by the machine using AI. Now, do we need all this? We may not need it, but that is the kind of advances which are happening with AI and robotics. Now, there are, it's not only the popliteal block, it can do IJV cannulation, difficult vein cannulation. No, for example, difficult subclavian veins, all these are being attempted. So using AI, the training from the information from the real-time patients, giving that power, giving that knowledge to the machine so that it can do the perform deeper tasks without person. So what we are also moving is, we are moving from an age in which we were using invasive monitors. We are moving towards non-invasive monitors, and in near future we'll be moving to non-contact monitors. That means we don't need, a tattoo can help us monitor how the heart rate is, what is the depth of anesthesia, what is the BIS, etc. We are moving from on-demand monitoring to, we have already moved to a lot of times critical ill patients to continuous monitoring. Now is the age wherein which we are moving towards predictive monitoring. Before, we want to predict how patients are going to do, when they're going to go wrong. So that is because the AI is being used there, right? We can also use it not only to general systemic well-being, we can also use it to assess regional perfusion. For example, we can predict whether the kidney is going to fail or not by looking at the kidney pictures beforehand. Before the kidney failure shows up, before the urine output drops, you can look at the kidney perfusion and say whether it's going to go wrong or not. Now, everything is not predictable. We all understand that. When we train these machines, when we train these systems, we have to use appropriate information. If you put garbage in, bad data in, so you'll get a bad output. So predicting, sometimes, it doesn't mean it is preventing. You cannot prevent it, right? Prediction means you have to act, but it's not equal to preventing. For example, let's say if the HPI index says, HPI prediction says, patient is going to go hypotensive in 10 minutes. What do? Do we act or do we not act? For depth of anesthesia, it is fine. Now, before the patient has drop in blood pressure, are we ready to use medication? If so, when to use it? And can we treat those things? These are all the things which we have to slowly think and give the feedback and help train and make the machines or the systems much better. Now, let us look at a few more examples in anesthesia and ICU. For example, we all have patients with multiple symptoms. Now, using AI tool, for example, it could be at a bigger scale, right? It could be an EHR. It can predict how many patients are going to need ventilation, ICU admission. It can also predict, depending on the kind of season, depending on what kind of diagnosis what has been made, how many will need ventilator, how many will need ECMO support. All this can be algorithm. It's very, very simple, not complex at all, but in which the machine can help us. One is predict how many patients are going to go, and also predict how many machines we need. Now, the other thing is in ventilation. For example, if somebody gets admitted to ICU, instead of just looking at the face and saying, oh, this patient needs ventilation, it can help you go through systematically and say whether he needs ventilation or not. If they are on ventilator, it can help you when you should start weaning. These are all the parameters which gives you, this is the peak inspiratory pleasure. So they can generate so much tidal volume by spontaneously. All this can be used to optimize and recognize and see how the patient is progressing and help in ventilation parameters. So this AI in mechanical ventilation is going to be there. All the machines will come which helps you predict whether the patient is ready. If so, how long it will take. The systematic reviews are there, which can be incorporated into the interventions. Now, what also is happening in the ICU side is, we all know sepsis is a big issue in ICU. And now, when these AI systems, when entire electronicization is happening, it can pick up from the vitals, it can pick up the investigation and what is treatment happening, and even from sometimes the unstructured data. For example, even if you're not documented, it can pick up the data from the unstructured clinical notes. It can mine the data and help you in early prediction whether this patient is going to become septic or not. Right? That is marvelous. We all have followed only the structured protocols. For example, WBC count is more than 12,000. We consider it as a prediction of sepsis. But we have to look at the total leukocyte count. But here in the unstructured data also can be used, data can be mined from those and can help you predict somebody is going to develop or somebody is already in sepsis. Now, this is again very big, using unstructured data. Whenever the data was unstructured, where it was not structured, like investigation, top to bottom, you had line. But if it is in the notes, you would not recognize it because you will not read through it. But these AI agents can go in, check those, pick those things, and come back to and say, no, this patient is probably going to go septic. We need some action on that. Now, what also it can help you is identifying the appropriate antibiotic. Now, this artificial intelligence is, the new Alexander Fleming. It can help you actually choose the appropriate antibiotic depending on what kind of area which is being operated on, what kind of problems they have, or depending on the previous history of sensitization of the antibiotic, or depending on what gut flora they have to avoid those particular side effects. All this is amazing because all this integration cannot be done by one human mind, but computers can do. AI can help you choose the appropriate antibiotic. For example, if I ask you, what is the antibiotic for an infection in the pancreas? We take a little bit of time. These machines can think what are the best antibiotics for pancreatic infection, pancreatitis. And also look at the gut flora. No, if you put this, the patient will behave abnormally. And depending on if you had created a digital twin, it can even tell you how the patient is going to react. So that is amazing. Now, what also is happening on the buy sides along with the AI is incorporation of VR, that is virtual reality, augmented reality, and medical and mixed reality, leading to what is known as extended reality, right? So this can be used in clinical training in number of places. We don't need to be having such a long hours of training. It can be implemented. People can be trained to a fantastic extent by using these systems. Especially, it's very good for interpersonal skill training, how to use the equipments, how to feel empathetic. All those things can be used, can be incorporated into the practice. And also it can improve the functional skill training. For example, I don't know how many of you have gone to simulation center. Recently, I had gone to Father Muller Medical College in Mangalore, and where they had a skills trainer for every block. For example, femoral nerve block they had, axillary nerve block they had, intraclavicular block they had. All these models are there to help you augment your skill. In that way, when we put our needles on the patient, we can be sure how it is happening. So it can also be used to plan what kind of surgery, what kind of access. So depending on the images, you can easily approach how to approach, what is the best way to approach, and which can cause the least systemic disturbance. And if you look at this, there are more than nearly 500 companies which are working on VR and AR. So on the medical side, okay, not about game side, there are these VR and AR applications which can be used to treat medications and also in other acute medical conditions. So that is the kind of development which is happening, wherein which VR and AR is being used along with AI to understand. Okay. Now, in spite of all these advances, what I have told, I strongly feel that the adoption of the AI in medicine is still not reached its capacity. We are only at the start. We are still nascent. Still, there are a number of conditions wherein which we can make the diagnosis early, we can treat them better, and have a fantastic outcome. What I want to exhort all of you is AI is going to be there. We have to lead, we have to partner with people who are using them and help encourage responsible adoption of AI into medicine. It is very important that there is a human control or a physician control and oversight of these systems when it comes to the medical side. We have to ensure it is robust and reliable, as good as medical things, what we are doing other things. So we should also understand what is the impact, societal impact and environmental impact, and also have a scientific rigor whenever we analyze, when we use these things. There should be transparency in everything, whatever is being used, and governance and accountability as well. We have to ensure this adoption of technology helps us reach the last person, even the most peripheral person living in any part of the world. Along with that is also important that when we are training these systems, there is potential that the privacy and data can be lost or can be made public, which we don't want to, and have adequate mechanisms to protect the data privacy. Now, few areas where I feel even now it can be adopted without any is even with our own small system. What we have is we can have systems, we can have applications wherein which it can suggest lower cost medications for pain relief. For example, NSAIDs like ibuprofen may be as good as the newer COX-2 inhibitors. It can help us trigger, no, you can use this in this patient. He doesn't have acidity. He doesn't have any renal problems. You can use this. Offer multimodal pain management wherein which we can employ less of opioids. Also, these systems can help us guide how much insulin have to give for this patient. We all know insulin, when we give if you give 5 units in one person, it works really well. In some patient, it doesn't work. We can have this AI helping us guide in diabetes management as well. We also can be used, whether it's in outside the theater or in the perioperative practice, what are benign headaches, etc., what are post-response headaches. It can easily predict what could be the causes. I foresee a lot of huge role in AI, especially these 5 domains. I feel all of us need to look through briefly and see where all we can incorporate and where we can start using. First is because EHR has become prominent, digitization is there. EHR data is being used or can be used to see how many patients are normothermic after surgery. By the time they go out of the recovery, how many of them have normal temperature? How much is the success rate? How much patients are receiving antibiotics? We don't need to go through individually. The systems can automatically show you this is the timing, this is the success rate, what has been there. So that is the beauty of digitization. AI can be incorporated in any of these things, and AI can mine the records and get you the diagnosis. In this one particular study from Vanderbilt University in USA, I want to highlight it. We all know patients can have MI. Before they have MI, a lot of them have ST, elevation or depression, and tachycardia. And they looked at the data and they found nearly 100, there's a 10-year data. So wherein which nearly 1.5 lakh people had these changes. Now let us see what they did with that. So it showed up that it probably happened at around 60 to 70 minutes after the surgery. Now, interestingly, if you look at there, it also gave them what did people do when there was suspicion of changes in the ECG. Some people gave beta blockade, some gave fentanyl, some aborted the surgery. All these things data would not have come out if you had not had an AI or an electronic health record. So because of having electronic health record, you have the potential to look through, mine the data, as they say, find the needle in the haystack and see what is our standard of practice. Our standard of care, is it the standard of practice? Are we doing well or not? This can be easily mined, right? For example, another interesting thing was we all had heard we probably need to use balanced crystalloid solutions. So they in their own way, they could look at the data without disturbing any of the care, which patients did well, which patients developed renal abnormality, and come to a conclusion that it is probably, if you are using balanced crystalloid solutions, the incidence of renal failure is less. They could easily look into it just by looking at the data, incorporating AI. Other interesting thing is, this was a publication way back in 1983. Now, quality of care is very important. Even in 1983, it was very important. And this was using a computer system critiquing the anesthetic management. Now, we all want the best of the care for all the people, and whether it is given by the senior most or the junior most, so the quality of the care has to be there. So they have developed systems. This semantic network can be used. This was way back in 83, wherein which they looked at whether the patient had pre-medication or not, GA or not, intubation, how smooth it was. All those things were developed way back in 1983. But in this era, it can be easily done and to predict how the outcomes are. If there needs any changing, what is the thing to do? So you can use this to devise a treatment plan for a patient. For example, if using AI, you can decide what are all the drugs which you need to give intraoperatively, how much dosage. And also, importantly, we are moving into a domain of precision medicine. Now, we are no longer in the era of one size fits all of them. For example, 2 milligram per kg of propofol, or 0.4 milligram per kg of morphine, or 5 milligram per kg of thiopentone. Those era is gone. Those era is gone. Now we have to find a way where we can give precision medicine. Already, when you're practicing TIVA or target controlled infusion, these things are being used. Gender, age, height, and weight is already being used in target controlled infusion pumps to deliver exact amount of the drug what this patient needs. What also in the pipeline are already being adopted is what is known as the omics data. What is this omics data? For example, people have identified what is the gene which makes people sensitive for propofol. If you use the same dose of propofol in those people, they can be deeply anesthetized. In some, it will not work properly. Those things can be done using pharmacogenomics. Now, believe me, I went to AIG recently, AIG hospital in Hyderabad. They have established a department of pharmacogenomics. In India, in Hyderabad, they're already using it. They also have established a department of artificial intelligence. That is how we are advancing now. Along with that pharmacogenomics, how our metabolism changes when we eat certain foods or stress. What is the biomics? That is, what is the gut flora? What is the flora in the mouth, and other things which can help us predict which drugs are destroyed by those bacteria, and lipidomics. Which fruit causes how much rise in these individuals. All this, and also the data from the sensors. All this together will help us give precision medicine and a precision anesthesia at unprecedented levels. AI also will play a huge role in developing drugs. All the phases of drug development, whatever it is, 7 phases, AI can be used. For example, I will tell you how it is advancing. In anesthesia, we all know remifentanil, some of you might be already having. Every drug which is coming now in that domain is going to be hugely advantageous because they are metabolized by plasma esterases. It doesn't need to be metabolized by the liver or the kidney. This group of drugs is going to be more available. What are those drugs which are available? For example, along with remifentanil, we know remimisolam is coming. It's already there in some place. So now we also have a soft etomidate, which also is metabolized by this. So one is the drugs which are coming, the targets, all those things. Every process can be fastened by using AI. That is going to be a big change even in anesthesia-related drugs as well. Now, medication management is going to be hugely changing because of so much of data available. And the more we train these systems, can help us deliver appropriate medicine and appropriate assistance for the right patient. Now, before I finish, now I want to say this. We always overestimate the change that will occur in the next 2 years, but always underestimate the change that will occur in the next 10. I am thinking of the next 10. Don't let yourself be lulled into action. So this Gartner hype cycle is very important there. But believe me, AI is one of those things like electricity or what we call it. It's a fundamental, basic, multidisciplinary or general purpose, advance, which is like how the movement changed, how the mobility changed after inventing a wheel. That is how significant it is. It is going to transform every part of our life cycle, our healthcare. So, in short, what I want to say, AI has the potential to transform medicine and improve patient outcomes. It remains important to carefully address the challenges and limitations associated with it. It continues to evolve. It is likely that it will become increasingly important tool in the healthcare system, enabling us to deliver improved care to every patient. But as clinicians, I want to reiterate, we need to stay away from novelty blindness. The moment the word AI is used, sometimes we get over enthusiastic and start applying at wrong places. We have to carefully investigate the safety and the potential clinical usefulness of all the digital innovations, including the AI, and make it a successful thing. Thank you very much.
Thank you so much, Subramaniam sir. It was indeed a really eye-opener for all of us. I think in future we should have separate department as which already is there in Hyderabad for artificial intelligence, and definitely textbook will have AI as a separate syllabus, sub-syllabus for anesthesia soon.
I'll tell you, ma'am. So I was really asked when I went to Hyderabad to AIG for some other purpose, for the other perioperative medicine conclave. I went there to this. They have established this department of AI, and they have around 700 endoscopies per day. And all those, it is anonymized and goes through a system of filtering, wherein which as you go through, the system automatically helps you say, these are the abnormal areas. This is where you need to take a biopsy. And what other place can develop? 700 plus endoscopies per day. Anywhere in the world, is it possible? No. It is possible. There is so much data to train. So we have so many patients, so much good people, so much advance happening in the IT field. We should be ahead in this technology and start using it in every place wherever we find it is there is a role.
From audience, anybody having some questions for sir? I think there is one more in chat box. Dr. Venkatesh Joshi asking, is there any career opportunity for doctor or anesthesiologist in AI?
Absolutely. So as I was telling you, every AI system or AI company, whatever is doing, they need people who can understand the clinical implications of it. For example, I am not a big entrepreneur or a big AI personality, but in my own sense, I felt there is a need for every consultation, we need speech to text, text to medical literature conversion. So along with my friends, we're trying to train the system so that the moment you have a conversation, it can record it, transcribe it, and transcription can be done into the medical field. And some doctors want, no, I have discussed a lot of things with the patient. I want to give an audio recording of it because they can keep listening to that. So that also is possible. So what else we want? Let's say, for example, I had a cardiac surgeon who said, no, medical notes is fine. I also want to share the advice what I give them so that they don't come back and keep complaining to me or asking me at inappropriate times.
So the voice they can store and they can go at home and listen again and reciprocate accordingly.
Yes,
Venkatesh sir is only asking which institute is best to learn the AI in healthcare all over world.
Now, there are programs offered by the Harvard, the Stanford, and some of the IIMs, especially IIM Raipur, where I have done, and ISB. They are all the institutions which have started the courses, and the Indian courses are nearly 1/10 of what you have to pay in the US. So, In Indian amount also, it is reasonably costly, but this is a domain which is going to go expand without jumping into it, without knowing details, how system works, how each of things works. So we will not be able to develop anything at all. So there is a potentially, as I told, AI in medical care is a 190 billion per year market. $1 billion I'm talking about. So that is the kind of market which we are talking about. So there is no doubt at all that all these things will be required. You have to develop appropriate contacts, appropriate people who can work with it. And the people who understand how to make a difference in those computers things. So we may not be learning C++ and other complicated languages, but our input will be very, very focused on how it affects the patients, how it affects clinically. I think that is where our role will be. But if some of you are good in programming, it's even better.
Again, now in India, in every corner to get internet, laptops, and all this system is difficult, but still prominent cities, majority of the healthcare corporate sector has everything possible. So how much will be the budget to develop AI department is asked by Dr. Shilpa Guru Madam, HOD of my Medical College.
A wonderful question, but it is very difficult to answer this question with a pinpoint accuracy because it depends on what we want to develop. So I will tell you one example. There is an app called Anura. Okay, so now what you need to do is you just need to log in and keep looking at the camera for a few seconds, maybe 10 or 15 or 20 seconds. It can tell, the applications are so advanced, it can tell what is our BP, what is our heart rate. It can tell us whether we are in good mood or bad mood. It can also tell us if there are any lipid patches suggesting that we have diabetes or not. So, and that is the kind of accuracy which can develop within 20 seconds, just like how we do facial recognition for our phone. No, it's exactly the same amount of time, and it can give you what is your predicted age, what is your biological age also. So that is how much advances are happening with just a matter of a small video.
Thank you, sir. Anyone having Bhavesh sir, Uma madam, Bhageshri madam, Maya madam? Maya madam is asking, are there any medical legal implication while using this new technology? Definitely new law.
Absolutely, man. Absolutely. For example, if we are using it for, unfortunately, we are governed by very, very high regulation. The medical community, the medical healthcare is regulated by healthcare laws. That is why a lot of applications have come in the consumer domain. For example, I was talking about Apple Watch or a ring. So now Apple Watch can recognize with 99.5% accuracy when there is AF, but we cannot use it as a medical literature as of now. So it, the consumer segment can only offer so much accuracy. So it is for us to validate, find a way to validate it and see how much accurate it is. For example, how many, I'm sure all of you do neonates also. Now, one of the things which scares me when I do a neonate or a young infant is, if I use opioid, will the child stop breathing? Right? That is the worry which all of us will have. Now, if there are smart socks which can be put on the child, or a smart gloves which can be put on the child, it can keep on continuously capturing what is the SpO2, what is the heart rate, and keep projecting it to which monitor you want. If the Bluetooth other thing, won't it be a wonderful thing? To get the medical literacy, it takes time. So, and that is the beauty of this. So the advantages are happening in the consumer segment first, but how much is actually adaptable, how much it's reliable, we have to use it in a controlled way. And people working in big institutes or those who are have safety mechanisms, they should choose first. They should use first under controlled conditions and then come out.
There is discussion with another workstation people. I will not enclose the company, but they are saying they are in association with one diagnostic center who are developing a number of hospitals across India, and they will have this artificial intelligence based monitor. So the doctor need not to be physically be there. So like experts will be called upon after integrating like artificial intelligence will record the data from the patient and give it to the doctor, then they will tell the treatment. Such kind of thing are also in the loop. Like
it can be possible, ma'am, but in India, the anesthetists come at a lesser rate compared to those higher
not
quality
anesthesia. I
systems.
think for ICU purpose they are
I
developing
suppose it
maybe.
is happening, ma'am. I will tell you, in Bangalore, there is a team of 100 anesthetists working on this remote ICU care. They look
Remote
after
ICU.
nearly around 270 places, wherein which all of them, whether it is in Jharkhand or etc., or Bengal or Northeast, they're all hooked onto the monitors, and those things are being projected onto the screen here. They sit in front of the screen, they monitor, and they suggest what needs to be done. So a cloud physician is there, but that is a technical extra. But there are a number of very useful things, ma'am. For example, even in a country like US, for example, let's say somebody has got a stroke. US being a big country, or for example, let's say we are living in Pune. So Pune is a place where a stroke can be handled effectively. For example, you want to give thrombolysis or thrombectomy, it can be done. If somebody comes into, like, for example, somewhere periphery of Pune, or let's say around 100 kilometers from there, they comes to a center where they have a CT. The CT can be done, and those CT images can be fed into the computer, and this AI can predict whether they are having stroke or not. Moment it is there, it can be triggered to the next level of care, like a hub and spoke, and people sitting in the Pune can direct what to do. It could be protocolized or individual consultation. So with teleconsultation, where images also can be seen, all this is possible. It is being done in other countries as well. Because, for example, pediatric neurologist, very hard to find in US. So there will be entire state where will be 3 or 4 people. So and these systems are being used there, and why not here?
There is another one concern, sir, like regarding safety of the patient. If we see the video of that robot doing the intubation, as a human being, as well-trained anesthetist, we will have the plan A, plan B, plan C ready. Like how much it will be precise, like difficult airways scenarios.
It's a very good question, ma'am. Very good question. Now, how do I see? I mean, for example, humans, our dexterity, ability to control different planes of movement, integrate knowledge, and our brain, which is perhaps the most brilliant ever produced by God or humankind, whatever it is there, it is more powerful than any of the. It is probably 1 million times more potent than all the AI systems what is there. So it is not a replacement, but people do it for passions, and it maybe have a future or not. For certain critical activities or time dependent or time limited things, I don't think we will have. But let's say, for example, if we have, let's say, a bronchoscope, as you go through, if it highlights you, oh, this is the arytenoid cartilage. You need to go anterior, go posterior. The AI assisted human will be much more powerful than a robot trying to do. So, and if even a 1-year-old child, if they fall down, no, they automatically get up and walk and run in a matter of months. So AI robots cannot do that thing. If they fall, they take time. Their perception is different, and they can suddenly collapse. They can break. So all those things can happen. So I don't think robot is such a big challenge for us. But what we have challenge is to use AI to enhance our work, to improve the quality of work. Adopt AI. For example, if all the, for example, today we have 40 or 50 anesthetists there. If we decide, no, we will use the recordings to train our bronchoscopic machine, what the arytenoid cartilage looks like. So bilaterally, how it looks like. So, and it can be fed into the computer. If it is done in a year, we will have a system ready within us to guide even a novice. No, you need to turn right, left, or flex it or deflex it.
Not
think
audible.
in that case, even the consent part will change. We will have different consents, and we have to take the permission from the patient that we are using AI for intubation or whatever the interventions will be doing it. So,
Absolutely.
yeah.
Ma'am, hospitals nowadays, they are coming out with ads. When the West also, we are AI first. We are using AI to help the care better for you. So they are advertising like that. So there are
Okay.
hospitals in Canada, Denmark, which have the policy of openly, transparently saying we are
Okay.
developing AI, we are using AI for enhancing your treatment.
Okay. Okay.
So, and there's nothing wrong. We have to be transparent. We have to say, yes,
Yeah.
we are using
Correct.
AI to make the outcomes better.
Yes.
We're not using robot. We are using AI to improve performance.
Okay. In that case, in fact, they will expect that AI should intervene in our day-to-day treatment, or maybe day-to-day surgical procedures, because they are also getting some knowledge about the AI. So even
Yes,
they
ma'am.
will expect that the hospital should be AI equipped or maybe robot equipped.
Definitely, ma'am. So definitely, for example, let's say if somebody has let's say a Down syndrome or a MH susceptible condition, the moment condition is fed there, the AI can help us eliminate the drugs. So if you feed the drug,
Right.
automatically the drug formula says, no, you cannot use volatiles in this patient. Or let's say some metabolic problem is there where propofol is contraindicated. No, you should not use it. Now, if you are using systems might be there which can tell you, no, you are administering vancomycin, not good for this patient. So,
Legal system will have a lot to work on it, I think, because
Yeah.
if things go wrong in an AI guided case, unfavorable results, then who's responsible? Like the doctor who's using AI or the AI itself?
that is where it comes from. Clinical discussion comes. I think that is where the humans, the trained anesthetists, will still have a role, whatever AI comes. So it is for us to use it as an aid, not to replace us. Use it as an aid to do. Just because fiber optic is there doesn't mean that anesthetists can do it. We need to be trained. And if the system is not giving us or directing in the wrong way, we should teach the AI, no, that is wrong. So if there's a patient with let's say if you type today in ChatGPT, how should I anesthetize a patient coming for, let's say, emergency C-section? If it doesn't say rapid sequence induction, we should think twice. No, it's not right. We should train the system. No, we need to give rapid sequence induction. We need to give precord pressure. Once people train it, it will automatically accept. But what also is sometimes these open AI systems it depends who is training. So if somebody is training in a bad way, it can be a bad thing. So
I think to begin with, it will be a lot of help in preoperative assessment. Like one of the medical tourism hospitals I worked at one time with a very different language and an interpreter in between. I was always worried whether the interpreter is translating my question rightly and translating the answer rightly, and whether I should
correct,
act. Maybe that part can be taken care of nicely.
that is so true, ma'am. When people have understood what impact the Google Translate have, it not only gives in words, it tells us also. You can be in a conversation mode so that it can keep to and fro. And what I was telling earlier, because it is so important, India being a diverse country, government of India has developed a system called Bhashini, where all 23 Indian languages, if you speak in Oriya, I can listen in Kannada. If you speak in Marathi, I can listen in English or Kannada. So that is wonderful, isn't it, ma'am?
That's great,
Perfect.
and we should
Yeah.
have it. I mean, history is so important to us.
That is true, ma'am. That is true. And especially if the language conversion can happen and helps us in documentation, it makes us so seamless, and it can go into electronic system, and it can be there as a record. So it is going to change how we are doing, but how much of capacity, how much of electricity uses, it all comes into picture. But I feel we will develop much more efficient systems.
Okay. Anybody having any further questions?
For further question, we need to take some degree or maybe some diploma in AI. I think sir has tremendous vast knowledge and it has really enriched us, sir. Thank you so much.
Thank you, madam. Thank you. Thank you. So
Thank
we
you.
all need to work together. We will develop next generation of AI applications so that all of us can use, and Indian-based applications, Indian-based,
Indian-based, made in India.
originated from India. Rather than calling it Indian-based, India originated items we will have.
Yeah.
Sir, I
Make
would
in
like
India,
to
made in
ask whether there is any center where one can get the training for this AI related to anesthesia or medical.
Ma'am, there are quite a few institutions, ma'am. There are some small private things are happening. So quite IIMs have started now because they are IITs also have started now. So slowly they have understood the importance of this getting involved, training a large set of people. And because it is still early days, but people who get involved can be leaders in that domain and start to develop systems.
Okay, but do we need the technical background for this, or on medical background also we can do this?
Medical background and basic computing is good enough, ma'am.
Okay, thank you.
Open mind, and sometimes I personally have seen working with people who are 20, 25, and they are different in their domain. For example, I recently had engineering student who came to me and they wanted to develop machine learning system to predict the BIS, to predict the amount of thing which given based on the EEG. So there are 19, 20-year-olds, so very exciting. And how did they come? They have not been into hospital. They have seen a paper from Korean article where they have looked at this, and they want to say if they have a recording of 5-minute EEG and
Yes.
know what levels have been done, so they can predict how they will do when the level is 2, when the level is 1. So they wanted to develop that neural network systems. That is how even our younger generation is taking up the AI now.
This neural network plays a very important role in AI.
Yes, ma'am, definitely, ma'am. Because some AIs use a rule-based one. Now, the more complex ones, for example, let's say if heart rate increases, there could be a number of reasons, and that is called, we call it as a semantic. It could be because the patient is light, it could be having pain, or it could be blood loss, or it could be something else, or pneumoperitoneum is created. So many factors are there. It can account all this and give a conclusion what it is. So that is where the neural networks are very important.
Yes, thank you, sir.
Anesthesia is, I think, the fastest developing branch in healthcare because our seniors who taught us have seen the open drop method and they have taught us workstation. Now, I think the anesthesia will take over fully with the help of artificial intelligence that fully automatically delivering anesthesia system with the observation of single anesthetist. So you don't need any helping hands. I think so in future, it's not too far. So, okay.
Yeah, if there
Bhavesh,
is no
sir.
other question,
So,
we'll ask
I would like
Dr. Bhageshri to deliver the vote of thanks. Thank you, sir, for the nice elaboration. Dr.
Thank
Bhageshri.
you. It's your pleasure. Thank you.
Thank you, everyone. Thank you, Dr. Subramaniam. It was really an excellent lecture. And now everyone will go ahead and check how we can use AI in our anesthesia practice. There was also an excellent moderation by Sheetal. Thank you for that.
Thank you,
Ganesh,
ma'am.
our technical assistant, thank you so much for helping out with this webinar. And I thank all the audience. Thank you, Anita ma'am, for being with us throughout the webinar. I also thank Dr. Saurabh Barde and Maya ma'am, Kothari ma'am, Vatkar madam, our past president. Thank you, everyone. And I conclude now this session is over.
Thank you,
Yeah.
ma'am. It's my pleasure.
Thank you.
Have a
Thank
good
you
day,
so
all of you.
much.
Thank
Thank you.
you, sir. Yeah.
Thank you. Thank you. Yes, thank you.
Thank you all and good night.
Thank
Thank
you.
Good
Thank
night.
you. Bye, bye,
Good
bye.
night, everyone.
Good night.
मॅडम मीटिंग एंड करायची का?
हो
ओके.
हो हो